Hello, today I'm going to talk about the quality of occupational therapist education in UK. First of all, I've been qualified for 17 years and I'm proud to be an occupational therapist. But one thing I must share with you guys, and this video is particularly aimed at any occupational therapist students, that I must explain that there were many times in my life, in my career, where I felt helpless, clueless. So I really had a bad time um, working because my knowledge wasn't quite up to the scratch. Only by working, attending different trainings, learning from other professionals, and by doing a lot of self-directed study and all that kind of stuff, and by thinking 24 hours about my work, I have come to the point where I've developed something that uh, it's difficult for everybody to carry out. Now, time and time again, I come across different services, different teams where the basics of rehabilitation is not delivered, particularly in the field of neuro, the cognitive rehab, the 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 physical rehab. It's mainly looked at function, but the OTs are not geared up to cater for the look at the impairment based work. And I think that has been a bit of a big challenge to establish and identify the profession. The training has been heavily focused on occupation focus, occupational dysfunction, and the theories. But actually, I beg to any university lecturer who is watching this video, is that actually, honestly, that really doesn't work. What works is that we have to learn from the physio how to do the exercises. We have to learn from the clinical psychologist, neuropsych, how to do cognitive rehab. We have to learn from other professions about the basic principles. And we are best placed who can combine principles from all disciplines to take it forward. So otherwise, this profession, our profession, will be facing existential threat. In a lot of places, we are only for discharge planning, but that's not the core skill of OT. Core skill of OT is to enable occupation, and how we can do it, best can do it when we understand the impairment-based work. We need to understand the principles of cognitive behavioral therapy. We need to understand how to deliver cognitive rehab therapy. It's not about strategy training. That I don't agree with. I would never agree with, because my patients only benefit because I work on the impairment. I really ask any OT student to go to university and challenge the educators, because I have come across students from all over the country, and they all say the same thing. When they qualify, they feel helpless, clueless. They don't know what to do, how to manage, because the quality of education. Finally, the importance of anatomy knowledge is so crucial. It is not given enough emphasis on OT education. So my request to any student, go and channel your lecturers, and if you're a lecturer yourself, think about how you're going to change it, change the profession, how you're going to make it more challenging, the education, so that the students come out with lots of experience. Particularly, use of self-directed learning is good, but that cannot replace exam. And in exam, people will have to understand the whole breadth, not one or two chapters. I really want my profession to thrive. I really want my profession to be continue to be the best. But urgent action is needed. So please, 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 everybody, let's come together and let's deliver it together. Thank you so much for watching.